This is a routine phaco in a fairly mature and intumescent cataract, and here I am initially placing my incisions, after which I put in an air bubble to aid me in staining of the anterior capsule with trypan blue. I express both the trypan blue and the air with 2% HPMC and go ahead with my pen 26 gauge needle for capsulotomy. And once I have initiated the capsulotomy, you can see the egress of the fluid, and that itself has decompressed the bag. I wash off a bit of the fluid, put in some more HPMC and continue with the bend 26 gauge needle. Probably at this point in time I should have taken a capsular excess forceps. That would have been far easier, but sometimes you just do these things for no reason. Then I keep continuing with my bend 26 gauge needle. Again there is egress of fluid. Again I just put in some HPMC and again I go ahead with the needle itself. So just looking back, it would have been much easier and more controlled with the capsular excess forceps. However, I did manage to get my rhexis, wasting few seconds, then put in some HPMC. There is no need to hydrodissect this cataract. Take my medium sized sharp chopper, and I am planning to do the direct vertical chop method. Nucleus is highly mobile, so you have to be a bit careful. Just very carefully separating the fragments. This is a pretty soft nucleus. There's no problem with the nucleus as such. And I'm at very low parameters. You can see that central disc there that has to be broken. And it is. I'm avoiding taking out the segments till I get enough segments. And once that's done, I start eating it up. I haven't changed any of my parameters. I'm at 400 mm vacuum and 40 ml flow rate. And you can see how easy this is coming out in no time. I'm also at continuous mode of phaco. I then take my bimanual and start cleaning up the capsular fornices, and this is going to be really time consuming. So I have to do it very carefully. This is a very advanced cataract. If I try to do it vigorously, I may pull out the bag. So I am trying to clean it tangentially and pull out these fibers, and it has to be done segment by segment. So where you need a lot of patience for this, but just has to be done. It is at these times that you actually lose the plot. You lose patience and you do something stupid. So very important to remember, just clean out segment by segment, change hands repeatedly if you have to. See, you see that capsule moving there. It's almost, if I had done it more violently, definitely I would have had some zonular dialysis. I also clean the posterior capsule as well. I'm at very low parameters this time. It's only at my polishing parameters, that is around 5 mm of mercury and 5 ml fluoride. Even this can sometimes prove a little too much. So once I feel I have more or less cleared most of it, there will be some parts you just cannot clear, just leave it. Rather than taking out the whole bag, I then go ahead and implant a single piece, in this case a hydrophilic foldable IOL. The trailing haptic is still outside the bag, so I just help it along with the Sensky hook. And now for the final touches, just removing all the HPMC from within the chamber, putting in my intracameral antibiotic and concluding my surgery. Thank you so much for watching.